Hi, everyone. My name is Cheryl Cohen. I'm with Arthritis Consumer Experts, and we are the host of Arthritis at Home, which is where you're joining us today. I am so excited to have someone that I literally have seen grow up in the musculoskeletal or arthritis community, and that's Dr. Jenny Leese. So welcome to the program, Dr. Leese.
Thank you so much, Cheryl. It's honestly a real pleasure to be here and be part of this program, Arthritis at Home. Thank you for having me.
Oh, you're welcome. So folks out there in our audience, may I call you Jenny?
Oh, please, yes.
Okay, great. This one instance, I'll use doctor. Dr. Jenny Leese is a postdoctoral fellow in the School of Epidemiology and Public Health. That means she looks at issues and concepts and problems and questions in really large populations. It's about getting at public health, the work that you're doing at the University of Ottawa and the Center of Implementation Research at Ottawa Hospital Research Institute. That's a mouthful. You're also a visiting postdoctoral fellow at Arthritis Research Canada, who, as you know, is our scientific partner and reviewer of all of the materials and programming that ACE puts out on behalf of people living with arthritis. Jenny completed her PhD in Rehabilitation Sciences at the University of British Columbia with a focus on ethical issues experienced by people with arthritis when using wearable technology in their self-care. So your work, as you've done your training, Jenny, has really spanned a lot of different areas, and we're so happy to have you on again. Thanks for joining. So what we want to talk about specifically today, and anywhere you wish to take this conversation, is a recent publication that was in a journal called Health Expectations. And it really focused on, I'll give the audience the title first of all, because I think it's fairly self-explanatory, actually. Experiences of self-care during the COVID-19 pandemic among individuals with rheumatoid arthritis, a qualitative study. So I'm going to start by asking you two simple things. Why focus on rheumatoid arthritis in this particular piece of work? And explain to our audience what a qualitative study is. Because I think a lot of people don't understand that sort of finer language in research.
Absolutely. Well, first of all, the question of why people with rheumatoid arthritis particularly, the inspiration for this study came from participants with rheumatoid arthritis themselves, who happened to be participating in two research studies that were ongoing, thinking back to March 2020, when the World Health Organization first announced the outbreak of COVID-19. And I was involved in interviewing these participants with rheumatoid arthritis, and they were telling me in those interviews about the challenges, the unique challenges that they were facing at that time, because of course this was a time when gyms, swimming pools were closing, physical activity was being disrupted, big disruptions to everyday life. And so it was really through those challenges to their self-care activities that, it was highlighted that this was the time to really take the opportunity to explore how the pandemic was really impacting the self-care activities of participants with rheumatoid arthritis. So that was really the background to the study. And also that piece around what is qualitative research. Well, it's really research that's interested in people's lived experiences. We do a lot of interviews in one form or another to really hear how people think and what people's daily lives are like in that kind of context, because we really want to get at what it's like to live with rheumatoid arthritis during this very unprecedented time that we're living through with this the pandemic.
Yeah, so the word qualitative is really quite descriptive. It's about getting at the quality of people's experiences, good, bad, or indifferent during this time. And you know, Jenny, true to all of the projects I've seen you lead or be involved in, the kernel, the inspiration came from people living with the disease, which I think is so essential to doing good research. I clearly, as a person living with rheumatoid arthritis, have a strong bias in that, so disclose that right off the top. But truly, the questions that you try to answer through your, you know, through the rigor of good quality science and scientific exploration has to be meaningful at the end. And so if you're trying to answer questions that nobody with arthritis was asking, what's the point? So I just, you know, huge congratulations to you and your co-authors for taking this on. So tell us then, Jenny, what were some of the key findings of this research?
Well, there were really some very interesting findings around how resilient the participants with rheumatoid arthritis had been. A variety of strategies, of resilience building strategies I was hearing. Everything from how to keep things in perspective was featured very commonly. And I was hearing a lot of participants say to me, I've been living now with rheumatoid arthritis for a time. I'm ideally trained for these kinds of challenges that are coming my way with this, you know, the physical distancing measures that were being put in place. You know, this is nothing too out of the ordinary compared to what I've been through before. And you know, perhaps the people I was speaking to were much more prepared than I was myself in living with, you know, the day-to-day challenges that the pandemic brought. So the resiliency was a huge piece. And one participant was saying to me, you know, it's been a learning curve.
Yeah.
In knowing how to deal with the anxiety and the fear that came. We were interviewing participants from March to October. So from the outbreak through those first 3
Yeah, that was really that almost first and almost second wave, I guess.
Yeah, so
Yeah.
a lot of anxiety, a lot of unknowns, changes in employment, fears for family safety, those kinds of anxieties that the participants were experiencing. But like I say, it was the resilience building strategies that really came through, the letting go of what can't control.
Yeah.
One, not borrowing tomorrow's troubles was another phrase one of the participants used. Being a learning curve, but it also being a calming curve too. So yeah, that resiliency piece was very strong.
Yeah, interesting. I mean, that certainly resonates in me, obviously, as a person who's living with the disease and actually was one of your colleagues on this paper. I'm so proud to say that those words about someone saying their rheumatoid arthritis was the perfect sort of setup, that we actually have been dealing with challenges that have imposed isolation, social isolation on us for the length of the time that we've had disease. That is actually what living with chronic disease can be like. And you have to develop strategies very early on, if you can, and with support, overcome them. You know me, I think I said in one of our email exchanges, the word resilience is a bit, for me, is a bit of a double-edged sword, because resilience can also mean people are there sort of taking it, not, you know, they've built up enough of a shell to just keep absorbing, you know, misery almost. So you have to be kind of careful as to what is good resilience and what is, I'm taking something and I'm accepting it, but I don't have to. Here's another way I can deal with some of these challenges. Tell us, what can researchers do? I mean, you've spent your training involving people like me in your work. You've actually been so masterful at it, and also just so generous, so loving and caring in the process. What can other researchers do, Jenny, to engage and include patients or people living with not just arthritis, but other autoimmune or chronic diseases? How can they involve them in their work in a meaningful way? What do you think? I'm asking you to toot your own horn here. What do you think you've done that's been successful in your work with patient partners?
Well, thank you, Cheryl, first of all, for
It's me patting you on the back. It's okay.
Thank you. Well, I think it's with the pandemic, it's a really challenging time currently. We have done research in the past where we were asking patient partners, what is meaningful engagement to you? And what really came across is the researchers understanding that they're partnering amidst multiple priorities in their life. It's not the one thing on their plate. So the researchers' understanding of that was really critical to being able to build that sort of mutual respect and understanding for each other and what each other was living with. And of course, with the pandemic, it's the disruption that it's brought is bringing more to those plates, more to think about, more to balance. And I think that, in our case, we've been incredibly lucky because we have this history of partnering with each other. We've strengthened those relationships. We trust, we have that mutual respect. And I think it's those long-standing relationships that have really been able to weather the storm, when the pandemic hit and the challenges it brought with us. So I think it's the value of really investing in strong relationships over time, not just one project, not when the project finishes, that's it.
Yeah, see you later.
I think that's really been very, very key, really.
Yeah, I would agree. I think if I flip the coin over and look at try to answer that question myself through my own lens, or through this direction, I would agree. It takes time to warm up. It takes time to learn. I mean, for those of us who are not trained as researchers, to come into the research milieu can be intimidating. You say to yourself, well, I can't be as important as that person. I didn't do all that training. But we're constantly trying to explain to people who have reached out to our organization and said, well, how do I get involved? One of the first things they say to us is, well, I don't really know what I'm doing. And I always say, perfect. That's exactly the point. What you know how to do and what you've been doing is living an experience that researchers are really interested in learning about. And who better to teach them than that person down, on the ground, taking those courageous, brave steps every day in a life with chronic disease. So I guess I would add to your advice about, being patient to the research side of the equation. Also from the patient or the consumer side, try not to be intimidated, try to ask questions. That old adage, no question is a dumb question, is so true in research, actually, in health research. I wanted to ask you about equity. And I know this is an issue in health research in general, unless there is a specific stated or well-articulated strategy to ensure for diversity in voice and in participation, and therefore findings and knowledge translation. Can you talk a little bit about the equity piece in health research, Jenny? I know it's not maybe necessarily your entire focus at the moment, but I know that it comes up in your research. And how can ACE, how can you and other researchers do more to ensure that we represent the full rainbow of human color and experience in our work?
I think this, I mean, it's just such an important question, isn't it, Cheryl? Thank you for asking it. And I think especially during the pandemic, you know, the health disparities have really been exacerbated by it and just at the forefront. And I agree, there's so much work to be done to learn how to better explore those paths forward so we can really hear different perspectives and really engage with communities that are most at risk, you know, in general and during the pandemic. And I would just say too that, you know, also in the research that we've done, we've seen just how important it is to avoid tokenistic efforts towards that. And again, it comes back to how to build trust, how to make sure that those partnerships that are being worked towards are authentic, especially given some of the legacies that we live with, you know, the difficulties of building trust that that comes with that. So yes, absolutely, a lot of work to be done, but I think given the pandemic bringing these sorts of issues more into the spotlight, you know, there's the work to be done, and maybe the time to do it. So
I think that trust piece is super important. And for our audience, at the end of our chat with Dr. Leese, there will be a link to the paper that we've been discussing, as well as to resources on health inequities and experiences of people living through the pandemic who also are challenged by living with a type of arthritis. You know, I guess a natural sort of conclusion to our conversation, Jenny, is sort of twofold. And that is, one, how do you plan, how does a researcher like you get the results of their work out into a broader, like how do people like me, apart from things like this, which I think are very important, disseminating knowledge at the grassroots level is probably key among them. But how will you go about making sure that people in your own community and those they serve through their research programs know about this article, this paper that's been published in Health Expectations, and also how people like me can use that knowledge to better self-advocate?
And you're exactly right. I mean, this is why this program, Arthritis at Home, is so important, because it does help to support that channel of communication between the research and you know, people with arthritis who are interested to learn more through this kind of channel, and also through social media as well, through Arthritis Research Canada, those sorts of channels that exist. But also in terms of how to help self-advocate, I mean, what we're really seeing through the findings in this study in particular is really the desire and the capability that people with rheumatoid arthritis have to continuously manage their health. They really are the experts, and it's sort of a question of how to support that resiliency and that ability to adapt. Like, as we've spoken, you know, that has been developed since, you know, the diagnosis, perhaps even before, you know. So yeah, it's about helping to support that self-advocacy and maybe in sharing these findings, you know, it can help those who may be struggling. And of course, you can struggle in some areas. Resiliency is a kind of point to be achieved. Some days better than others, some areas more than others. It's dynamic and complex. So yeah, hopefully these findings can help just to support those who may be struggling and give some pointers at times when they may be needed.
Yeah, I think, it's very interesting when you live with chronic disease. I think just whether by design or just by nature, you begin to self-advocate, you begin to ask for the things or state the things that are happening to you, or ask for the things that you need to lead the best quality of life that you can at any given point in time. That those things, I don't want to say they come naturally, because they don't, not to everyone. In fact, I would argue probably fewer than half it comes naturally to myself. I've been living with rheumatoid arthritis for 31 years now, and every day I learn something new. But the things that have been talked about in your paper are just such brilliant kind of pandemic hacks, if you will, with RA, and they don't, they're not going to just apply during a pandemic. They're going to carry on. I think these are it's a new toolkit we've developed, us clever community living with RA. And so I really encourage people to read the paper. I think a lot of people, whether you have rheumatoid arthritis or not, if you have some type of physical mobility challenge, if you have another type of autoimmune disease, you are going to find something of interest, I think, in this paper. And what I love about it, Jenny, is that peer-to-peer learning. That one of your study participants talked about, X, Y, or Z, and the other one talked about A, B, and C. And now we've exchanged lessons and pandemic hacks, if you will, right within the context of your paper. And I think that's what's so exciting about the type of research that you and your colleagues in public health and in qualitative work like this do, not just in this instance, but every day. Really super appreciate the time you've taken with us. Just a reminder to our audience, we will provide a link to the paper. Thank you, Dr. Leese, for making it open access so that the entire world can read about this incredible work that you've done. More and more we are pressing to try to get particularly these types of studies into open publications. Open meaning it's free. You can download and share as much as you like on your own, throughout your own personal network or on your social media channels, as you mentioned earlier, Dr. Leese. Any parting words of wisdom or encouragement for our audience today?
Well, I would say that this is just one study of more to come. We are continuing interviewing and finding out more about, other pandemic hacks, as you say, that we can all learn from each other as we go forward. And just before I leave too, I also would like to say a real sincere thank you to all the participants.
Yes.
Who took part. I mean, it literally could not have happened without them, and also the patient partners that we had on our team, and also the researchers, my supervisor, Linda Lee, also at Arthritis Research Canada. She's
an amazing champion, isn't she? Yeah.
Fantastic. So yeah. A big thank you to everyone involved. Thank you, Cheryl.
Thank you, Jenny. We're so, I like to call you Jenny on our block. You're an amazing person, just a great human being and a wonderful researcher who really looks at the whole person. And when you engage with patients like myself, the respect for us and the value we bring to your work is so apparent, and we thank you for that. So we want to, all of us at Arthritis at Home, thank Dr. Jenny Leese for joining us today. To talk a little bit about her paper. You're going to have a chance to read it in full. At the end here, we'll provide you with the link, as well as a few other resources of support that you might tap into during the pandemic, and as well maybe some reading about health inequities and what we need to be mindful of when we are able to access services. The sad reality is that there are many behind us who cannot, because of the sort of the baked in inequities in healthcare. So just a little bit of homework for you at the end. So thanks again for joining us. Thank you, Dr. Leese. You're always a pleasure to speak with. I appreciate it very much, and please be well.
Thank you, you too.